Surgery could be made quicker and safer with the use of virtual reality, according to scientists gathering for a meeting today in Leeds. They say the new technology could revolutionise the way operations are planned and carried out.
Behind every successful operation is a thorough knowledge of anatomy. The revolutionary technique of virtual reality is providing new ways to learn about our bodies. In Germany, medical students can learn anatomy using Frida, a virtual reality woman. She's being dissected in a virtual reality operating theatre. Through their goggles, the students see her as three-dimensional. Because the position sensors on their gloves are linked to a computer, they can reach out and move muscles and bones. Virtual reality will help train the surgeons of the future. They'll have to learn how to use computers just as well as their scalpels. British scientists are pioneering new ways of representing the body with computers so that the relationship between our various organs can be visualized. But they've gone even further. Using virtual reality, they're simulating what would happen when tissue is touched. Nothing real is being moved here. It's just an image. Using a headset inside which are tiny TV cameras and sensors fitted onto a glove, the scientists can interact with that image, performing simple surgical procedures. The next step, they say, is to simulate cutting and bleeding of tissues.
I'm sure the surgeons would be delighted to be able to fly around or to walk around the inside of a body that's been reconstructed using, for instance, the CT scans or the MRI scans that are now commonly available in hospitals, so they get a good 3D understanding of a particular patient before they go in and cut that particular patient open.
Computer graphics are changing the way we see the body. As well as teaching anatomy and simulating operations, computer technology is set to make operations quicker and safer. A common problem in surgery is the removal of a tumour. This is a computer image of the inside of the brain, showing a tumour at the centre, surrounded by blood vessels. The problem facing the surgeon is removing it without causing damage to the brain and the blood vessels around it. It'll soon be possible to allow the surgeon to see both the real brain and the computer display at the same time. This is what will be seen through a surgical microscope. The surgeon can see inside and around the tumour, instead of just the surface of the tissue being cut.
It is likely to be safer for the patient if the surgeon has a clear idea of where the vital structures are that it's important not to damage. It should also make the operations quicker if the surgeon's able to have a better idea of where structures are, so they don't have to go so slowly.
Computers and medicine have always been close partners. In the future, because of virtual reality technology, that partnership will become even closer, and many patients will benefit. David Whitehouse, BBC News.